I'm going to start with a 360 view of the room. And I'm going to begin by performing hand hygiene and donning a clean pair of gloves. I'm then going to use an alcohol swab to clean my stethoscope. Perfect. Hi there, my name's Lisa. I'm a student nurse here at Seneca Hospital. Would it be okay if I performed a physical assessment on you today?
Yes.
Perfect. I'm just going to check your ID bracelet to confirm you're the correct patient. Can you state your full name?
David Smith.
And your date of birth?
November 20th, 66.
Perfect. So the patient is the correct patient date stated on the documentation. David, are you in a comfortable position?
Yes.
Do you need to use the restroom at all?
No.
Awesome. I'm just going to close the curtain to provide for patient privacy. And we're going to begin our assessment by assessing the ears. So the ears are symmetrical bilaterally. When I palpate the tragus and the auricle, do you feel any pain?
Nope.
Perfect. So no tenderness there, no discharge. I'm going to begin by performing a whisper test. I'm going to state 3 words in each of your ears, and I'd like you to repeat those words back to me.
Orange, apple, banana. Plane, car, truck.
Perfect. Next, I'm going to be palpating your frontal and maxillary sinuses. Just let me know if you feel any pain here. Do you feel any pain on the frontal?
Nope.
And any pain on the maxillary sinuses?
Nope.
Perfect. So no tenderness, no pain. Next, we're going to assess the nose. The nose is midline and centered, and there's no signs of any discharge. Next, I'm going to be inspecting the lips. The lips look hydrated, there's no swelling, and no lesions. Could you open your mouth for me, please? So I'm just going to compress the tongue and inspect the gums. The gums are pink. There is no swelling, no bleeding. The teeth are evenly distributed. They are white in color, and there seems to be no dental crevices. Are you able to move your tongue to the roof of your mouth for me, please? Perfect. So no signs of any lesions. The tongue is hydrated. And move it down. Perfect. Open your mouth, no lesions. So the hard and soft palate are intact. Next, I'm going to be assessing cranial nerve 9 and 10, which is the glossal pharyngeal nerve and the vagus nerve. So can you open your mouth for me and say ah?
Ah.
Perfect. So when the patient says ah, the uvula moves up and back, which means the cranial nerve 9 and 10 is intact. Next, we're going to test for cranial nerve 11, which is the hypoglossal nerve. I'm going to get you to stick your tongue out and move it side to side, please. Stick your tongue out and move it side to side. Perfect. Awesome. And say light, tight, dynamite.
Light, tight, dynamite.
Perfect. So there was no signs of any tremors. Cranial nerve 11 is intact. Next, I'm going to be assessing the neck. So upon palpation, do you feel any pain?
Nope.
Perfect. No tenderness. There seems to be no signs of swelling. The thyroid is not enlarged. Perfect. The temperature is warm. Perfect. Next, I'm going to be checking your carotid arteries. So I'm going to check each side individually for 1 minute. Perfect. So both are equal bilaterally, and the grade strength is +2, and the beats are symmetrical. Next, I'm going to be assessing for cranial nerve 12. So this is where I'm going to ask you to move your head to the left and right, and I'm going to apply a bit of pressure. So can you move your head to the left, please? Perfect. And to the right. Perfect. And then shrug your shoulders. Perfect. Did you feel any pain?
No.
Perfect. So cranial nerve 12 is intact. Next, I'm going to ask you to lift your sleeves up. I'm going to be assessing your upper extremities. Do you feel any pain upon palpation?
No.
Perfect. No tenderness. There seems to be no signs of swelling or edema. No scars or lesions. No physical deformities at all. Perfect. Okay. Next, I'm going to be assessing your fingers here. So the nail beds are curved and smooth. The nails are curved. No signs of any lesions. Perfect. Great. Next, we're going to be doing some range of motion exercises. If you could stand up for me, please. I'm just going to get you to put your arms out like this, and we're going to flex the fingers, extend the fingers. Flex the wrists, extend the wrists. Perfect. We're going to do supine, pronation. Then we're going to shrug the shoulders. Perfect. We're going to flex the elbows, extend the elbows. We're going to do abduction and adduction. Perfect. And internal rotation, external rotation. Perfect. Did you feel any pain?
No.
Perfect. So there's no altered range of motion, no sign of crevices. If you can just take a seat facing with your back facing this way for me, please, and remove your shirt. Perfect. Going to be assessing the posterior thorax here. So when assessing, we see that there's no skeletal deformities, it's midline, there seems to be no lesions, no scars. Do you feel any pain?
Nope.
Perfect. So no tenderness, no swelling. Can you take a deep breath in for me, please? Perfect. And out. Perfect. So chest expansion is symmetrical. Next, I'm going to auscultate for the lungs. So when I do this, I'd like you to take a deep breath in and out for me. So deep breath in and out, in and out. Perfect. So the breath sounds smooth and even. There was no cackling, no gurgling. If you could just face forward for me here. I'm now going to auscultate your anterior thorax. So just the same thing, going to get you to take some deep breaths in and out for me there. And in, out, in, out. Perfect. So there's no crackling, no wheezing. The breath seems symmetrical. Your respiratory rate was 60 BPM, and it seems equal. So that's the end of our assessment today. Thank you so much.
Thank you.